Welcome to Afternoon News at OnTheMove TV. And today we tackle a burning issue of our times, Canadians' lack of physical activity. First, we have Dr. Walker, the Physician General for the city. Doctor, please tell us how we can fix this.
When talking about improving public health, active transportation is an extremely important tool. The World Health Organization recommends at least 150 minutes of moderate to intense physical activity per week. In Canada, the facts are clear. 36% of men and 31% of women do not meet the recommended amount of physical activity. This lack of physical activity has numerous repercussions, resulting in increased risk of cardiovascular diseases, diabetes, cancer, and mortality. While these numbers might seem daunting, the promotion of active transportation represents a huge opportunity to improve public health. Studies have shown that modal shifts to active commuting leads to increased levels of physical activity and thus improved health outcomes. The health benefits of increased active transportation are not just physical but mental as well. Physical activity from active transportation can reduce stress, anxiety, and depression.
Thank you, Dr. Walker. Now we have our reporter Jill, news lady on the street, giving us a word on the street.
Thank you, Bill. I'm here today with Karen Biker to tell us more about how she is active.
I'm very happy to hear the good doctor saying we need more exercise and just walking to get public transportation or to get groceries can do the trick. But I have to say, it is tone deaf to tell us who live in this transit poor food desert neighborhood. We want to be healthy. We want to follow the recommendations, but we simply cannot. So please, I urge the doctor and other representatives to look our way to allocate more transit hubs, put in more bike lanes and safe pedestrian walkways and crossings, and economic activity will follow.
Thank you, Karen. Back to you, Bill.
Thank you, Jill, for that much-needed reality check. Now we turn to the Chief Economist of the city, Dolores Green. Tell us what your take on this is.
Thank you, Bill. Indeed, not only does inactivity have large consequences on people's health, but it also puts an enormous economic burden on the healthcare system. If we encourage more physical activity through active transportation, we could drastically reduce healthcare expenditures. In fact, in Canada, healthcare costs represent $421 million due to non-communicable diseases and mental health consequences of physical inactivity. Inactivity is also responsible for productivity losses due to premature deaths. These costs represent around $13.7 billion globally in international dollars. So these savings would massively outweigh the cost of active transportation infrastructure and investments.
That's it, folks. We have heard from the experts. We have heard from the people. The first step to mitigate the risk of cardiovascular disease might just be ditching your car the next time you have to step out and walking to that nearest metro or bus stop. Stay safe, stay sane. Good night.